The House of Representatives has urged the World Health Organization to guard against discriminatory practices in the pursuit of a vaccine against the coronavirus pandemic. Chairman House Committee on Healthcare Services Tanko Sununu made the call when the newly appointed WHO country representative paid him a courtesy visit at the National Assembly complex in Abuja. This visit by the new country representatives of the World Health Organization to the legislative arm of government is the first since assumption of duty in Nigeria. And this also will accord the lawmakers update him on the level of legislation. Chairman of the House Committee on Healthcare Services, Tanko Sununu, commending the role of WHO in containing the COVID-19 pandemic, stated that countries of the world must have unfettered access to the vaccine irrespective of their status in the Committee of Nations.
The principles of ethics, especially now that we are moving towards a lot of multi-centered, multinational clinical trials to ensure that the principle of justice in ethical researches, in medical researches, is attained. By justice, it means all human beings are equal. And the beneficence of it, the benefit of that research must also translate to all, so that there is no segment of the world that will be used as a scapegoat in trying to achieve solution to the world.
He further assures of the readiness to cooperate and work with WHO in ratifying all conventions to ensure universal health coverage.
Nigeria and all over now we are facing the ugly head of non-communicable diseases, most especially diabetes, hypertension, and malignancies. So cancer is becoming an issue world over. So we thought there is need for database. We also thought there is need for policy. We also note that there must be a program of prevention and surveillance to address issue of cancers, especially now that the resources is going down. And then finally, the other bill was blood transfusion. The WHO also champions the need for safe blood transfusion.
Earlier, the country rep reiterated the commitment of the organization to work with Nigeria to convincing policymakers.
And that program has three main targets. 1 billion more people having access to universal health coverage. 1 billion more people protected against health emergencies. And 1 billion more people benefiting for better life and well-being. And Nigeria population is part of those 3 billion. And to ensure that the 3 billion, the Nigerian portion of the 3 billion access universal health coverage, we need legislators. We need your support.
Indeed, a lot needs to be done in the wake of the novel coronavirus pandemic ravaging the world, especially now that the world is facing financial crisis, and the House is assuring of its utmost support to the WHO. Clara Kiba Ko, TV News, Abuja.